It was a sunny morning when Mrs. Ellis, a 30-year-old teacher in her third trimester of pregnancy, arrived for her routine prenatal visit. She felt healthy and excited about her first pregnancy, with no unusual symptoms. As part of her prenatal care, Dr. Lara Hayes, her obstetrician, ordered a series of routine tests, including a urine culture, a standard practice for pregnant women. A few days later, the lab results arrived. The urine culture showed E. coli with a colony count exceeding 100,000 CFU-ml. Mrs. Ellis was asymptomatic, no fever, pain, or urinary discomfort. Dr. Hayes explained the findings during a follow-up call. Mrs. Ellis, your urine culture indicates asymptomatic bacteriuria, which means there are bacteria in your urine even though you don't have symptoms of a urinary tract infection. This is common in pregnancy and needs to be treated to prevent complications. Dr. Hayes proceeded with an evidence-based approach. We'll start you on a safe antibiotic to clear the bacteria and reduce the risk of kidney infections, which could affect your pregnancy. I'll prescribe amoxicillin for now, as it's both effective and safe for your baby, she said. She further explained that nitrofurantoin could also be used but is generally avoided close to delivery due to the risk of neonatal hemolysis. After completing the antibiotic course, Mrs. Ellis returned for a follow-up urine culture, as per guidelines. This confirmed the eradication of the infection. Dr. Hayes praised her diligence and educated her on the importance of staying hydrated and maintaining good perineal hygiene to prevent recurrence. During one of her subsequent visits, Mrs. Ellis inquired why treatment was necessary for a condition that caused no symptoms. Dr. Hayes patiently explained, "Asymptomatic bacteriuria in pregnancy is one of the few instances where we treat bacteria in the urine, even without symptoms. If left untreated, it increases the risk of pyelonephritis, kidney infection, which can lead to preterm labor, low birth weight, or other complications." She also elaborated on the follow-up process. It's essential to confirm that the infection is resolved because pregnant women are at higher risk of recurrent bacteriuria. If we identify it early, we can manage it effectively and prevent any harm to you or your baby. Dr. Hayes reflected on Mrs. Ellis's case during a team meeting, emphasizing the key lessons. Asymptomatic bacteriuria should always be screened for and treated in pregnant women during the first trimester. E. coli is the most common pathogen. Amoxicillin is a safe first-line option, but alternatives like cephalexin or nitrofurantoin may be used depending on susceptibility and timing in pregnancy. A repeat urine culture after treatment is critical to confirm the eradication of bacteria and ensure ongoing maternal and fetal health. The risk of untreated asymptomatic bacteriuria includes pyelonephritis, which occurs in up to 30% of untreated cases, along with complications like preterm labor and low birth weight. Asymptomatic bacteriuria may not cause discomfort, but its silent risks make it a priority in prenatal care, she concluded. In cases like Mrs. Ellis's, evidence-based treatment is essential to safeguard both mother and child.